Good evening, everyone, and welcome to 12 News at 6. I'm Mark Curtis.
And I'm Kadiva Devine. Here at 12 News, we have taken so many calls from people who thought they were going to a legitimate rehab or sober living home, only for them to be shut down.
And we're getting questions from the community who tell us they don't know what to look for or how to find a reliable place. 12 News journalist William Pitts talked to an expert today who provided some helpful advice.
A lot of guys had just been there. I was like, that seems weird.
There was just drug paraphernalia all over the place.
He was using inside of the home. He had overdosed.
None of these people tried to find a bad rehab, but in Arizona, it's become hard to find a good one.
You need a real evaluation by someone who has some letters.
Nikki 40 has a lot of letters after her name. She has a degree in psychology, a master's in public policy, another master's in clinical social work. She's a licensed substance abuse counselor, social worker, and she's on her way to becoming a lawyer. She says Arizona's not doing the best job of helping people find legitimate rehab programs.
There's this misconception that placing them somewhere is better than the status quo. And that's not always the case.
Because settling for the first program you can get into doesn't always work out. In Arizona, some rehab programs have cost the state more than $1 billion in suspected fraud to the state's Medicare program, according to the state attorney general's office. We've heard of programs that use YouTube videos, some that are accused of billing for dead people or people in jail. The state has suspended hundreds of businesses' ability to bill the Medicaid program, leaving some businesses shut down after allegations of fraud.
There were not as many safeguards in place. Could we say part of it was naive? To think that there wouldn't be someone who would see the potential of making money.
So how can you find the right program? 40 says it starts with a real assessment from a professional of what you need. Inpatient, outpatient, detox, they'll tell you.
It should really start with a very thorough assessment and screening process.
Then you can also look for accreditation from something called the Joint Commission.
That's one of the things they look at is show us all of your documentation, show us your paperwork. How are you effectively placing people who are coming to you for help?
Those are not necessarily things that the state of Arizona looks for because it doesn't license every business. There are loopholes. So 40 says you should also ask questions, find out what they teach and what happens if a client relapses. If they don't have answers, you may want to keep looking.
And while the state does have AZ CareCheck, it's not the same as accreditation. CareCheck doesn't license every facility. When it comes to sober living homes, for example, state law does not require a license for a business to call itself a sober living facility. William Pitts, 12 News.
All right, well, thank you.